Cancer. We've all had some experience with it. Mine came at the age of 6 through a relative. Others experienced the disease at other points, whether they were friend fighting it or they were fighting it themselves. I'm lucky my grandma pulled through. Others were not so lucky. Cancer is talked about a lot, but not everyone knows what it really is. Most just know that it is a disease that, if left untreated, can kill you. While this is true, cancer, or by the medical term, malignant neoplasm, is so much more. It is the uncontrolled growth of cells. These cancer cells are produced again and again and again. They perform no function for the body. They just eat nutrients meant for useful cells. They crowd the useful cells. The good cells die, the cancer cells remain, and the body slowly dies because the cells that keep it running are no longer there. That only happens if the cancer is left untreated. There are many kinds of treatments out there. This is good, right? Being treated can give you a better life, right? Unfortunately, that's not always the case. I will go over the pros and cons of two of the most common cancer treatments. Then I will talk about the emotional and mental roller coaster cancer patients go through during treatment, and give some advice to everyone who knows the cancer patient. First, though, are the treatments. Two of the most common cancer treatments are radiation therapy and chemotherapy. The two can be used separately or together, but each is only effective against certain types of cancers. Chemotherapy is the treatment of ailments through the use of chemicals. It is used to treat many diseases, not just cancer. Chemotherapy, or chemo, is delivered intravenously and works to stop cancer by impairing mitosis. It targets rapidly dividing cells and kills them. Since cancer divides rapidly, these cells are often killed by the chemo. Chemotherapy is pretty successful, but it affects tumors with higher growth rates faster than tumors with lower growth rates. This is because the treatment is attracted to rapidly dividing cells. The faster the cells divide, the stronger the attraction. 63% of cancer patients who receive chemotherapy treatment are still alive 5 years after they contract cancer. Another common type of treatment is radiation therapy. Radiation therapy is the medical use of ionizing radiation to control malignant cells. Unlike chemotherapy, radiation is aimed at a specific part of the body that the tumor is located in. Radiation beams are aimed at the tumor and work to destroy the cancer cell's DNA. Depending on how successful it is, radiation could kill the cancer cell, or it could just stop the growth and division of the cell. This is still an improvement over the fully functioning cell that it used to be. Radiation therapy is said to be between 60 and 90% successful. As you can see, the cancer treatments we have today are not 100% successful. They do, however, give you a better than 50% chance of surviving this deadly disease. These treatments probably look pretty good right now, but I only gave you the positives. I can tell you, the list of negative side effects is much longer. The most common side effect a patient may have while undergoing chemotherapy is hair loss. In fact, almost every patient gets it. Most people realize that if you see a bald kid or woman walking around, they probably have cancer. They don't know why. I'll tell you why. Cancer cells divide and multiply quickly, so chemotherapy targets cells with similar characteristics and kills them. Not all the cells it kills, however, are cancer cells. Hair cells are killed too because they also divide quickly. That's why our hair grows faster than the rest of our body. The cells divide faster. Other rapidly dividing cells that chemotherapy kills are located in the bone marrow and digestive tract. By killing these cells, the body is unable to produce as much blood as it needs. This increases the chance of bleeding and bruising because there are fewer white blood cells to clot the blood. The dead cells in the digestive tract cause inflammation, as well as nausea, diarrhea, constipation, and other gastrointestinal problems. Other side effects of chemotherapy can include depression of the immune system, which makes you more susceptible to illness, vertigo, and infertility. More serious side effects include heart, liver, and kidney damage, and brain dysfunction. Those last four are potentially fatal. Radiation therapy has lots of side effects too. During radiation treatment, patients are likely to experience fatigue, skin irritation, swelling, and intestinal discomfort. Sounds minor, right? The side effects that occur years later are much worse. These can include infertility, hair loss, fibrosis, heart disease, and cognitive decline. Very uncomfortable side effects is dry mouth, dry eyes, and the inability to sweat. You constantly have itchy eyes, always seem thirsty, and have no natural way to cool yourself down. And that's not even the worst of it. The last side effect is the most serious. Radiation therapy can actually give you cancer. That's right. The very thing the radiation is fighting. Radiation kills cancer, and then gives it back to you 20 years later. Chances are, when you receive it the second time, your body is weaker and less able to fight back. Receiving cancer again is rare, but if you do get it again, it has an even greater chance of killing you. One last disturbing thing I learned is that 50% of cancer patients die from the disease or its treatment. Yes, the treatment can directly kill you. This can be due to an overdose of chemotherapy chemicals used by a nurse who wasn't paying attention, or improperly set up radiation equipment that gives you more radiation than your body can safely handle, or any other kind of mishap with the dosage. You are trusting nurses and doctors to help you survive, and they can kill you if they make one mistake. Imagine lying helpless in a hospital bed, watching someone you barely know pump chemicals into you. Imagine knowing that if they screw it up, you could die. With all these side effects and bad odds, I wondered what the emotional state of cancer patients must be like. I learned that almost every cancer patient begins to feel isolated or alone during the treatment, even if they are surrounded by family and friends. They believe they are on their own because nobody knows what exactly they are going through. I also found that over half of cancer patients are forced to deal with anger, anxiety, and depression at some point during the treatment. Some cancer patients undergoing treatment have difficulty sleeping, find it hard to interact with family or friends, or shy away from intimacy. These just further isolate the patient, making some believe they're going through the battle by themselves. Many of these patients believe they will die from the disease, especially if someone they know has been killed by cancer. This can lead to panic attacks and other common symptoms that patients undergoing treatment can have. A Baylor College of Medicine study shows that friends play a critical role in the emotional state of a cancer patient. Many people don't know what to say when talking to someone with cancer, but it's really quite simple. Be an empathetic listener and let the patient tell you what they're going through. Alleviate any guilt or blame they may have, and remind them that it is not their fault. Help them with their daily routine, and offer to assist them with work, cleaning, etc. These two steps can greatly improve a patient's morale. But can it help them survive? The common myth is that happy, upbeat patients who believe they will beat the cancer have a better chance of surviving than those who believe they will lose the battle. While this is false, believe that cancer patients are twice as likely to commit suicide as the rest of the general population is. I'm sure that the suicidal patients are not the ones that believe they will win their battle. It's patients who are depressed, lonely, and don't believe they will survive. Why go through the stress of treatment and discomfort or side effects if you don't think you'll survive? Better just end your life early and save yourself from suffering. This is an unfortunate stat to keep in mind if you know somebody fighting cancer. I'm not saying cancer treatments are a bad thing. I think it's fantastic that there's a greater than 50% chance of defeating the deadly disease. I'm just saying that you don't know how hard the battle is until you experience it yourself. So give the cancer patients you know all the support you can. It's an emotional roller coaster. You don't want to see somebody end their life because they feel they can't win the battle. I hope you find this information useful if you know a cancer patient. I've given you some information about cancer, 2 different treatment types, a list of nasty side effects, and some things to consider if you know a cancer patient. Remember, giving support to a cancer patient can't save them from disease, but it can't hurt them either. And after what I've just told you about their emotional state, I would give them all the help you can.